Why Canada's healthcare system is one of the best? First of all, we have Medicare. Free medical treatment is available for all Canadian citizens and permanent residents. Services not covered by Medicare include ambulance services, prescription medication, and dental work. The basics remain the same. Universal coverage for medically necessary healthcare services provided on the basis of need rather than the ability to pay. We count with 5 main Healthcare Act principles. Number 1. Public administration. The provincial and territorial plans must be non-profit. Number 2. Comprehensiveness. They must ensure all medically necessary services provided by hospital settings. Number 3. Universality. They must entitle all insured persons to health insurance coverage on uniform terms and conditions. Number 4. Accessibility. They must provide all insured persons reasonable access to medical services without financial or other barriers. And number 5. Portability. They must cover all insured persons when they move to another province and when they travel abroad. By now, you may be wondering how it works. So, instead of having a single national plan, they have 13 provincial and territorial healthcare insurance plans. This way, all Canadian residents have access to hospital and physician services without paying out of pocket. The provincial and territorial governments are responsible for managing, organizing, and delivering healthcare services to residents. The roles of the provincial and territorial governments in healthcare include the administration of health insurance plans, planning and funding of care in hospitals and health facilities, as well as supervising services provided by doctors and other health professionals, planning and correct implementation of health promotion and public health initiatives, and the negotiation of fee schedules with health professionals. Talking about our private clinics, they are not legally allowed to provide services covered by the Canada Health Act, but many do offer such services. The advantage of private clinics is that they offer services with reduced wait times compared to the public healthcare system. Private clinics are subject of controversy, as some feel that their existence unbalances the healthcare system and favors treatments to those with higher incomes.
Some of the recent changes have been in primary care, aging population, rising rates of chronic disease, and other changing health trends have emphasized the need for the healthcare system to continue to develop capacity to respond to the changing needs. Reforms have focused on setting up more community primary healthcare centers that provide on-call services, placing greater emphasis on promoting health and managing chronic diseases. In electronic health, technology is a significant driver of innovation, sustainability, and efficiency in the healthcare systems by improving access to services, patient safety, quality of care, and productivity. The implementation and use of electronic health records contributes to care renewal by facilitating the integration of services amongst care providers. Wait times reduction. In provincial and territorial clinics to reduce acute care wait times accordance with the priorities of individuals, the systems include training and hiring more health professionals, clearing backlogs of patients requiring treatment, building capacity for regional centers of excellence, expanding ambulatory and community care programs, developing and implementing tools to better manage wait times. Patient safety includes the avoidance of medical errors or adverse events, one of the most significant issues facing health systems globally and a growing aspect of Canada's efforts to improve the quality of healthcare provided across the healthcare system. The federal and provincial territorial governments are continuing to work with healthcare professionals, organizations, and institutions to mitigate the risk involved in delivery of healthcare. Lack of doctors and nurses in Canada. Recently, there has been a shortage of doctors and nurses in Canada. Some feel that Canada's healthcare system does not adequately compensate healthcare providers. This has led to a brain drain of Canadian doctors and nurses, which have led Canada to pursue careers in the United States. Attracting and keeping skilled medical workers is a priority if Canada is to be able to provide proper medical services. Prosperity Index Survey. Legatune Institute carries out a huge survey that ranks most of prosperous countries in the world. Health is measured by the following key components: economy, entrepreneurship, opportunity, governance, education, health, safety and security, personal freedom and social capital. According to the list, Canada is in place 11 in the health measuring their health expenditure to be and 4,520 per capita. Their immunization rate against infectious diseases is in 95% and life expectancy is 80.9 years.